obviously, I'm assuming most of your patient population demographic is females or females in that sense, and maybe not, but this is my assumption from not
Yeah,
knowing anything,
I
right?
love it.
And
I love it.
and so I want to ask, what is the majority of patients that you see? Do you see like males or mostly females and so forth? And then maybe we can go into other stuff after that.
Yeah, it is definitely not all females here,
Yeah.
but certainly a bit more shifted in that direction. I think the last time I looked at it, our visits were between 70 and 74% people who identify as female. And then probably like 25 to 30% male. But then we also, do our gender affirming hormone care visits where people may identify as gender diverse, gender non-binary, or we have, trans men and trans women as well. So we do all of it. And I think that's like a huge misconception across the board, is that like Planned Parenthood is for women only.
Yeah.
We see a lot of men in our clinic who come in for STI screening, want to talk about ways to have safe sex. And then I think as we've gotten more into safe sex with PrEP as well, so taking a pill to make sure that you're preventing the transmission of HIV, that has brought more men into our clinics as well to be able to access those services.
Interesting. And then for prevention of pregnancy, right? You said you provide
Yes.
education.
Mhm.
I'm thinking immediately like birth control, right?
Yeah.
And what is your determining factor of when to prescribe birth control pills versus just safe sex education? Because I've known, people who have had, they don't like the pill or,
Mhm.
they had like weird reactions with it and so forth. So like, what is your kind of determining factor? Are you always going to the pill, or like, what's your mindset with that?
Oh, I love it. So couple of things. First of all, the pill is definitely not my favorite birth control.
Yeah.
My favorite birth control on a personal and also like global level are IUDs. And the reason why I like IUDs is because you put them in once and they work for years, and they don't require somebody to remember to take a pill every day, which, let's be honest, that's just hard to do. I love it when they've done studies of men taking antibiotics twice a day for 2 weeks. Like less than 50% of men do that. So we expect women to take a pill once a day for their entire reproductive life, which is like over 20 years, never once mess up. It's crazy. It's
Yeah.
it's totally crazy, right? Especially when like a lot of times they have side effects to those pills. You may not be eager to take it. So what I like about those long-term methods is I call them the set it and forget it methods. You just get to put it in once and it's working for you. So on a personal level, I love those methods. My answer though, as a doc, is the best method for the patient is the one that I have that they're buying into.
Mm.
So my goal in talking about contraception and doing contraceptive counseling is to get to the best answer for that patient, which
Mm.
is different for every single person. So the way I start talking about birth control, which I did this all day yesterday, the way I open this conversation is, tell me what birth control you've tried before and what you liked about it or what you hated about it. And so then when they say, on this method, I had these reactions, and on this method, I had these reactions, I take all that information and say, then I think this might be a good answer for you. So it's very individualized. So I don't think there's like a perfect birth control for everyone. I think the perfect birth control is the one that you kind of look at all the options and go, this one maybe seems like the least of all evils, right? Because I mean, there's kind of like some annoying side effects to almost everyone. And what I say to women is like, I'm also here to just like walk with you through this journey. Let's try pills. If you hate them, if you have negative reactions to them, come back to me. We'll go back to the menu. We'll keep trying stuff together and hopefully find one that lands well for you.
Mm.
Um, as far as, practicing safe sex versus being on birth control, I used to be a bit more paternalistic about this, like you must be on birth control. And then I realized like they were going to go home and probably just not take their pills. They're probably going to say to me, oh, sure, Dr. Potter, I'll take those pills because you basically just forced me to do it. Right.
Right.
But like, are they buying in? Are they actually using the method at home? Who knows? So in terms of talking about this, again, I come back, and this is kind of that technique I was talking about earlier around behavior change, but I really come back to the idea of motivational interviewing. Have you heard that term before?
Emotional
Um,
interviewing.
Motivational
Oh,
interviewing.
no, 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 no.
And it's cool. It was originally created by, I think, social workers and therapists, but it's kind of this idea of, in any type of counseling conversation, how do I, as the healthcare practitioner, not give you the answer,
Yeah.
but help you to identify the best answer for you, right? And so that's how I approach these conversations with patients. So, if somebody is sexually active, I'm kind of flipping the conversation back to them and saying, "How would you feel about getting pregnant right now?" "Oh, you definitely don't want to be pregnant. That would ruin your life." "Okay. How do you think What do you think about ways to not be pregnant?" So I'm really like flipping it back on the patient. And they go, "Well, on pills, I had all these terrible reactions and I didn't like it. And on Depo, I bled all the time. And, I had the one that went in my arm and I hated it." "Okay, okay, cool. So I'm hearing not this one. I'm hearing not this one. I'm hearing this side effect to this one. So what about this one? What do you think about that? And here's why I'm suggesting this one, because you told me all this information here." So I'm kind of taking what the patient is telling me they need and want, and then trying to kind of use my expertise to go, "Okay, these are all of our options on the menu." But then in my response, also being like, "What do you think about this? What would be the good about this? What would be the bad? And are you willing to give it a shot?" And that's I think has led to better success for me in getting patients to the right method for them, is to also say, "This is a trial. Like, come back to me in 6 weeks. If you hate it, we're going to pick something else. And we're just
Yeah.
going to trying stuff together."
And I think it motivates the patient, right? Because they're it's not like they're coming to you and you're providing the answer. They're almost giving you the answer, and they feel like they're in control of their own care, which I try to do a lot, as much as I can, with a patient. And sometimes I don't ask this question, but like, what do you, as a physical therapist, what do you believe you have to do to get better? And sometimes the answer is just as short as like, "Well, I don't know, I called you." And
Right.
so but sometimes they're like, "Oh, I don't know, I have to do like some stretches, or I have to do this and that." And so, or I have to do some kind of massage or something like that. That kind of tells me what their preconceived beliefs are for getting better, right? And so with all my knowledge, I'd be like, okay, if they like massage, or if they like hands-on treatment, I can do that, and then like slowly
Yeah.
graduate them to exercise. But then some people are like, "Oh, I'm gonna have to do some exercise and get better." I'm like, "Okay, perfect. We're on the same, like this. Yeah, great, awesome."
I
Like,
can dive in with you and go straight there.
yeah,
Yeah.
yeah, 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 yeah. So that, I think, and that needs to be done more with patients, is just giving them, making sure that they feel like they're making the choice to do and be a part of their own care, rather than like the doctor being like, "Just do that, go home."